Başlardım ya.
Distinguished chair people, ladies and gentlemen, first of all, I congratulate your medical day. I think this should be a day of celebration because it's an important, being a physician, our profession is an important component of who we are, and we need to make use of these symbols because we're going through some hard times. I think there will be some important debates, and I myself wonder what sort of an introduction my speech will be, because it's mainly criticizing, full of objections, controversies. As we deal with concepts, it seems to me that even when you handle the most well-founded concepts, you have the chance to probe into it. And here you will see a few sentences about the term placebo. Placebo is not a concept that's as well-founded as we think it is. It's difficult to define it. Placebo, in fact, means I will please in Latin, and nocebo means I will harm. There are various attempts to describe the term placebo. I'm sure that it's very clear in your minds, in your heads, but it's not really so clear. My favorite is the last one. What's common to all treatments? This is the 4th description, and I will try to explain to you through my speech what I mean by it. But all these 3 descriptions are descriptions that are not agreed upon by the general population. You may not have observed that some people criticize placebo, because placebo is usually criticized by social scientists, and there are some very heavy, very considerable criticisms. Although we regard placebo as a foundation, as a basis where the medical claims are tested, social scientists usually say that a placebo is fraudulent, it's conceit, it's lying, they say, because you lie to somebody saying we're giving you a drug, but you don't actually give them the medication. And it's not really very consistent, we learn from social scientists. Looking at some animal studies, there are some placebo control groups, even in animal trials, animal studies, but there is no placebo in surgical work that's conducted, as if it's not medicine at all. Placebo is regarded as the neutral material, but studies reveal that many things can be involved in this concept, such as visit of the scientist, atmosphere of the clinic, the high technology used, the way physicians are dealing with the problem. Do the physician and the patient know themselves, and what sort of an understanding does the physician show to the patient, and does the physician bring about the concept of trust, the feeling of trust? People can believe in a physician and let the physician take over the bodily and mental mechanisms, the control of the bodily and mental mechanisms. This is being questioned in the social sense. What's discussed about placebo is, in fact, arising from an understanding of the psychopharmacologists themselves, because those who claim to be real psychopharmacologists say that a medication has to have a specific action, and They're saying, I don't care about non-specific effects. Everything is the effect of the medicine, and if there is something arising, it's probably because it's not yet defined in specific terms, but there is nothing that's non-specific. My speech will be countering that opinion, because whether you like it or not, there is something called non-specific. You don't only cause the changes in your body and your mind when you're taking or giving the medication. There are some other non-specific things that arise. So yes, it exists. Generally speaking, in order to say that a drug is effective, the ratio between placebo and drug should be 1 to 1.3, placebo being 1, medicine being 1.3. There are differences according to the patient. For example, asthma, zona, and ulcer treatments, placebo has an effect of up to 66%. Sachs just made this speech about placebo response because it seems that bipolars respond much better to placebo than other disorder groups. There are other things. For example, placebo is more effective in clinical pain, in severe pain, and in milder depression than the severe forms of these illnesses. That's something very interesting here. And some pharmacologists do not accept the non-specific effect I said, but if you give a person something, no matter how neutral it is, it shows an effect similar to a medication, and it causes side effects as well. We're used to that. We already know it, especially in medicine-supported studies. We see that some placebos have even higher side effects. Some side effects here are insomnia, headache, nervousness, and nausea. They have peak and accumulation effects. Larger capsules and injections have a higher effect than smaller ones. Especially those colleagues working in the eastern part would understand why patients prefer injections. Yellow capsules seem to be more stimulant and have a more antidepressant effect, whereas white capsules are more effective in analgesic terms. I'm sure that the pharmaceutical companies know these and take these into account. You might have certain opinions about placebo. For example, who is affected by placebo is usually female and not very bright and open to changing her opinions by talking, but this is not the case because we don't really know who responds well, and there isn't a placebo reactor that's found. This is a confusing situation. It's a complex situation because there's a self-regulatory structure almost. And what we can agree on would be that our organism, our mental and bodily integrity, uses the HPA to compensate for this hyperstimulation no matter what we give from the outside. And it's also been shown, by the way, before I explain why this is the case, that once something is given, it doesn't have to be a medicine. When there is an intervention on the psychology or the body, there's something called time-bound sensitivity, because there could be a late response. That's the reason for antidepressants providing a late response. That's the lag period, and the same applies to placebo. The third control group, what I call the third control group, is, we have double-blind studies in medicines. These guys here are saying if a placebo works like a placebo, so we have to also work on the third group to test placebo. In psychiatry, everything is much more complicated because here placebo seems to be more powerful, and as a result there are many theories put forward. For example, chloropomazine seems to be superior in acute psychosis, and placebo response rates are up to 30 to 45% in long-term schizophrenia. For the prevention of relapse in bipolar disease, placebo has an effect of up to 30%. In dysthymia, the response rates vary. I think it may be due to difficulties in diagnosis, so we see a range of 15 to 50%. In anxiety disorders, this rate raises up to 65%, but in panic disorder, placebo effect remains at 22%. The most striking results are obtained from OCD. I don't know how you can interpret this, but in many studies we see the rates are between 3 to 13%. This seems to be the least placebo response, this OCD. For depression, everything is much more confusing. It's so chaotic that some big men some prominent men say, why don't we give placebo to treat the patient? And this is even published in respectable journals. I already said that placebo should be thought of as the medication itself, but there are also some other non-pharmacological placebos, such as the expectations of the patient, trust of the patient, belief of the patient in the physician, etc. So it seems we need both placebo groups and the other test groups. Here are some questions that help us think more about placebo. We know, okay, let's leave aside conventional treatments. Let's say that Avicenna has done everything wrong, but we don't trust all our colleagues, do we? Hearing all these rumors, sometimes we are even questioning the competencies of our colleagues, but they continue treating patients. Why? Which one of us can dare do malaria or insulin coma treatment, and why again? We are all undoubtedly better than Avicenna. What makes us better, and whose healing potential is higher? Here's another, let's leave aside the rumors, here's another conclusion of the research. In general practice, 40 to 60% of the cases are misdiagnosed. This is clear. This is very clear. But who would say, yes, I fall within that range? Everyone believes their treatment is right, and everyone believes that their recommendations, their advice are the most realistic that's around. However, 40 to 60% of the cases are misdiagnosed, and some patients, despite this fact, are benefiting from the treatment. If you say to a person who is healthy, a healthy individual, and say that I will do this and you will feel much better, 82% of 100 people say, yes, I feel much better. If I say to you, move your right leg a little bit, you will feel better. 82 out of you say, yes, I did feel much better because of this effect. If this is such a big effect, shouldn't we then ask, what's the difference between placebo and psychotherapy? Jerome Frank is the authority in this area and says there isn't a big difference. When we talk about treatment or therapy, there are two things that come into play. One of them is to regulate the specific pathological processes underlying these morbidities. And secondly, we seem like we're curing the demoralizing non-specific effects of diseases. These two always have to be kept in mind. He says, when I look at how psychotherapy works and how placebos work, whoever says they're different is wrong, because there are in fact 4 similarities, and that this is how they function. First of all, both the physician and the patient believe in a rational conceptual scheme. Most of the charlatans have a rational basis for whatever they do, even if some people don't believe them. Furthermore, there is an emotional relation based on trust between the helper and the one who receives help. Everything is done for the sake of health, so there is a institution of health. And fourthly, there is the effect of rituals. And if all of these are combined, there is therapy. And he says very assertively that placebos should be seen as psychotherapy. Jerome Frank is an interesting person. That's how he explains the success of conventional treatment, and he says we shouldn't really get in the way of those traditional treatments. Coming now to the main question, what's this impact, what's this effect of placebo, even if they are contradicting the modern medicine as we know it? Here is a quote from Frank Adenauer, who says that the most competent function, or let's say the biggest function of the human mind is symbolization. Everything, talking, thinking, falls under the same scope. He makes a reference to Adolf Meyer. Adolf Meyer probably takes these from Cassiral, all this symbolization philosophy, because that's what he bases all his philosophy on, and he discusses the difference between religion and science in this sense, and says that symbols are what separates animals from humans, not language, because animals have their language, but men create their language by symbols. And Frank says this is a human-specific difference, and that we should move from that. And I agree with him. If we perceive that something will be good for us, something will please us, most of the cases, whatever it is we're perceiving, we are triggering our muscular system. The system of pleasure, sorry. If we believe that the medicine, the technique, or the relation between the physician and the patient will be good, then this network of meanings strengthen, and this system of pleasure activates and gets stronger as more inputs are accepted into this network. And that's, here we can talk about group therapy or family therapy as opposed to giving therapy to a single patient. This could be a provoking question to be asked at this point in time. And I think you would also witness somebody saying to his friend or his family, relatives, whoever, that this physician is very good, and then the response you get is much higher in this case. I don't want to take too much of your time. Finally, I'd like to say there is something called placebo. In order to understand it, we can deal with philosophy and what differentiates men from animals. It seems that what differentiates us from animals is symbolization. So whoever thought of placebo studies and animal studies is not doing very relevant very relevant work. However, in medical studies, we need to think of placebo, surgical studies as well. We need placebo control groups in surgical studies as well, and psychotherapy. Surgeon colleagues say to us, is this really science? Is what you're doing really a branch of medicine? If we're taking scientific studies as the basis, or evidence-based medicine as basis, we're far ahead of surgery, and we should now invite them to prove what they're doing is right, because it seems to be the most primitive